Hi guys, it's Lillian again from Kenya to Montana, USA. Welcome back to my YouTube channel. From our previous video, we were talking about a hospital rejecting you as an international nurse or as a new nurse from an agent. So what happens if you've been rejected by the hospital? So, this is business. The agent is doing business and he's invested a lot in you. And also you have a contract with them. They need to provide you with employment. So they won't just sit and wait for anything. They will look for a job for you. They look for, maybe you might be taken to another state, or they might get you into, it's very rare to get you into the same state because this management is somehow correlated. So they might take you to a different state in a different hospital. Or if they find that your case is so severe, they might take you to a nursing home and you will continue earning. And before that, they'll take you through some classes. If it's about attitude, they'll take you through classes and you will learn. By then you will have learned your lesson. Nobody wants to stay unemployed even for 1 hour, because you have bills to pay and you need to earn every hour. You need to be earning. So you start just if it's about attitude, you will learn. You will change. By the time you get to a new hospital, you'll have changed. If it's skills, they take you. If it's advanced, they have skills lab. They take you back to the skills lab and they teach you how to do all those things, patient care and all the procedures. They'll teach you. If it's about the preceptor, they will deal with that thing. Before this thing, for the most of the people who are returned, the issue is always the preceptor. So one thing I would like to tell you, if you have an issue even on day 1 or day 2 with the preceptor, there is your nurse manager from your agent who is following you up. You have to report. They always call every week. They call to find out how you are doing when you just start job. So this your nurse manager from your agent, you need to be open and let her or him know how things are on the ground. If you think the preceptor is unfair to you, you need to report earlier. You have phone calls. They always pick their calls, and if they find voicemail, they will still respond back. So the best thing is, when you get any difficulty with anybody, you need to report this. And when you report, these things are put into the account, so that even if something comes out like being sent back, they have some evidence that there was a problem even from the beginning and you're the one who reported early. So when you report, and apart from a phone call, it's good to do an email. An email is you send an email to that your nurse manager, explain that you have this preceptor but you think he's not being good to you, he's being mean to you. Report everything you see that is going to get you in trouble. You might think you just want to cover up, so you finish your orientation, but then you finish your orientation and then you are sent back. And you see, if you don't have any backup, if you don't have evidence on your side, you find it becomes so difficult for you, because they think you can't perform in the hospital. They will imagine you have invested in the state in the north, like Montana, and then they take you to the south. They take you to Texas. You start again. You bought some things on this end. You need to ship them to the other end. It's very demotivating. It's a waste of money. It's waste of time. And you already been your morale has already gone down from just the fact that they are taking you back. But then when you go back, you have to work on yourself. If it's about skills you don't know, you have to work. YouTube is there. Get YouTube and go through those skills, go through those procedures, let them flow in your head. You will learn them. Another thing I would like to tell you is when you are on the floor, try to be nice. Even if you are not, you already qualified, you are no longer on the orientation, just be nice to everybody. Try to help. When you see somebody is so overwhelmed, there's a time you are three nurses and you find there's one nurse who really got the heaviest assignment. His or her patients are just taking her on the toes. Be the one to help out. Just don't sit on your computer, on your phone. You are there and somebody cannot even sit down for a minute to document. One of your colleagues is just running up and down and you are seated there on the computer, you're seated there on your phone, you're chatting, you're talking on your phone, and your colleague is there doing his job. Be nice, be helpful. That bell is ringing for like 10 minutes and you are there on your phone. Maybe your colleague is busy somewhere, he's been held up in a patient's room, but you are there just on your phone. To be honest, you need to, when you be nice, be helpful, just stand up, go answer that bell. You might just say, I came to check, and I will let your nurse know if it's not something. It might be something very crucial, that when you are sitting there and somebody's dying, because it's not your bell, it's not your patient, so you don't want to go. Please be kind enough, be helpful, and work as a team. Be a team player, because the people they are watching you. Everybody is watching you, and these guys, it's just because we don't talk relate so much, but they still talk behind your back. They'll still talk and say this one doesn't help, this one is not a team player, this, because at the end there are people who are asked to evaluate you, and you don't know who that will be. But if you are helpful, you went to see a bell, an alarm, like somebody calling and is not your patient, and you helped out, you become somebody will just talk good about you. So don't sit down even when you're on orientation. And I'm not saying you should go and answer all the call lights. No, you cannot answer all the call lights because you have your patients. It's just when you are free and some call lights are ringing for long and you're just there. You can see somebody, you are free. You've been sitting for an hour and your colleague has been running down, is anahema kabisa, he's been running up and down all through since he started the shift. And you are comfortably seated on your phone. You get your phone and on your computer you're chatting. You might have patients who just need Tylenol at 9 p.m. then they sleep until morning. So if you have that one and there is somebody who is giving pain medication every hour is in that room. Every hour is changing somebody who has diarrhea and he has diapers. Every hour is somebody's calling you for what. So you need to be helpful. Just get up and help. That way it makes people want to work with you. They make people like you. They just feel you are part of them. But if you make yourself busy, make yourself busy, everybody is watching and you don't know who is watching your back. So we just trying to fit in a system that is very new. You need to fit in. Even back in Kenya, the call lights were ringing and all of us were attending. Although I know some people who, when they just give medication, they say they'll never attend to that call light back home. But now let's forget about back home. You are here. Be nice. If you are nice, even if something happens to you, at time you can get those type of patients yourself. If you never used to help somebody, nobody will come to help you out. And maybe you'll have procedures, you don't know how to start an IV line. If you didn't help somebody change a patient, or just going to see that call light, that person will not come and help you to start that line. You don't know how to put an catheter or an NG tube, and you need people to help you. See, some of us, you can't be good in everything. There are some procedures you're not good at. If you ask me to fix an NG tube to an adult, to be honest, I won't be able to. I need help. I just need help. That one I know. So if you know you are not good in all these things, be good in the other things like changing the diapers. Be good in walking the patient to the bathroom and back for another nurse, so that when you these tough procedures that you don't know, when you get into, you need to do them, these nurses will come and help you. If you are nice, you are nice to them, they are very nice to you. If you are helpful to them, they are so helpful to you. So guys, see you in the next video. I think I will end it there. Bye.